Childhood leukemia, advances in treatment, what's changing fast, and who's benefiting first? Few words strike fear in parents' hearts like childhood leukemia. Yet today, hope shines brighter than ever. What was once a near-certain tragedy has become one of modern medicine's most remarkable comeback stories. Thanks to stunning scientific breakthroughs, children diagnosed with leukemia now face a future defined more by remission and recovery than despair and uncertainty. Understanding the enemy. What is childhood leukemia? Leukemia is a cancer of the blood and bone marrow, where immature white blood cells grow uncontrollably, crowding out healthy cells. In children, the most common form, acute lymphoblastic leukemia, ALL, makes up about 75% of cases. It progresses rapidly but responds well to targeted therapies if detected early. Less common types include acute myeloid leukemia, AML, and chronic myeloid leukemia, CML, each with its own unique genetic and molecular profile. The era of precision medicine gone are the days when every child received the same chemotherapy cocktail. Today's treatments are guided by genetic fingerprints of each cancer. Doctors can now sequence leukemia cells to identify the exact mutations driving tumor growth, such as the BCR, ABL, MLL, or FLT3 genes, and match them to specific drugs. This approach, known as precision medicine, minimizes unnecessary toxicity while maximizing effectiveness, allowing physicians to fine-tune treatment down to the molecular level. CAR T therapy, reprogramming the immune system. Perhaps the most revolutionary advance is CAR T cell therapy, a treatment that turns a child's own immune cells into cancer-fighting machines. Scientists extract T cells from the patient's blood, genetically re-engineer them to recognize leukemia cells, and then reinfuse them into the body. Once inside, these supercharged T cells hunt down and destroy cancer with stunning precision. For children with relapsed or treatment-resistant ALL, CAR T therapy has delivered remission rates of over 80%, offering a lifeline where traditional therapies failed. Smarter, softer. Chemotherapy. Chemotherapy remains central to leukemia care, but its design and delivery have evolved dramatically. Newer regimens are shorter, less toxic, and better targeted, reducing the long-term side effects like organ damage, infertility, and developmental delays. Supportive treatments, like anti-nausea drugs, infection control, and growth factors, have also made therapy safer and more tolerable. Targeted drugs, changing the game. Drugs like imatinib, Gleevec, and dasatinib, originally developed for adults with CML, are now being adapted for pediatric use. These drugs block the molecular switches that leukemia cells use to divide uncontrollably, sparing healthy cells in the process. Meanwhile, monoclonal antibodies such as blinatumomab act as bridges between cancer cells and immune cells, helping the body's natural defenses finish the fight. Beyond cure. Focus on quality of life. With survival rates now exceeding 90% in childhood, attention has shifted to life after leukemia, preventing relapse, monitoring long-term side effects, and supporting emotional and cognitive recovery. Many hospitals now offer survivorship programs that provide tailored care for children growing up after treatment, focusing on mental health, learning support, and hormone balance. Who's benefiting first? Children in countries with access to modern genetic testing and clinical trials, especially in North America, Europe, and parts of Asia, are the first to benefit from these therapies. However, global initiatives are working to close the gap, bringing advanced treatments to developing regions through international partnerships and drug subsidies. The road ahead. Next-generation treatments are exploring gene editing, CRISPR, to correct leukemia-causing mutations at their source, nanomedicine to deliver drugs directly to cancer cells, and AI-based diagnostics to predict relapse before it occurs. The once impossible dream of a world without childhood leukemia now feels within reach. The takeaway: childhood leukemia, once a heartbreaking diagnosis, is becoming a story of victory through science. With precision medicine, CAR T therapy, and smarter drugs leading the charge, The battle is being transformed from a desperate fight into a calculated, hopeful journey, one where the youngest patients are, at last, the biggest winners.